This is Stephen Winzenburg. I'm a communications professor over at Grandview. For the first hour, let's talk about sleep disorders with Joe Fisk, who's the coordinator of the Sleep Referral Center over at Mercy Hospital. Joe, good morning and welcome to you.
Good morning, Steve.
The reason why I was interested in this subject is because during the holidays, we tend to change our patterns of eating, our patterns of maybe staying up a little later than normal, getting excited about the bowl games. And a lot of people then also change their sleeping patterns. Isn't that true?
This is true.
And with you over at Mercy Hospital at the Sleep Referral Center, you see these different cases of people who have trouble sleeping, and what we want to do is talk about some of those problems today. So first of all, tell us what you do over there at the Sleep Referral Center.
Basically, we diagnose and treat sleeping disorders such as patients with insomnia, narcolepsy, nocturnal myoclonus, and obstructive sleep apnea.
Okay, now explain those things, since I understand none of that. Insomnia, I kind of understand.
Okay, insomnia, the patients we treat are people who have trouble for 3 months or greater. And these people have trouble at least 5 to 6 nights a week. And basically, either they have trouble falling asleep or they cannot maintain sleep. And these are the ones we would see. Otherwise, we'll work with them over the phone and different behavioral treatments with them at home so they don't have to come to the center.
Yeah, people with insomnia, that's a very small percentage of the people you work with, right?
Right. We maybe see 10% of all the patients we see have insomnia.
So if somebody just has one night that they can't sleep real well, maybe it happens to be a couple of nights in a row, they don't have clinical insomnia.
Right, and that's normal. Everybody has a bad night. Okay. A lot of people have bad Sunday nights because they've slept in late on Sunday morning and then they have to go to bed at 10 to get to work the next day, and you're not ready to go to bed.
Okay. What are some of the other ones that you mentioned for sleep disorders?
One of them we treat is called nocturnal myoclonus, and these are people whose legs rhythmically jerk at night. Approximately every 20 to 30 seconds, they'll have a leg movement which causes an arousal in their sleep, which causes them to be tired the next day. Basically, their only complaint is insomnia because they don't know what causes them to have all these micro-arousals. Or the spouse will complain, he kicks me all night long, or she kicks all night long.
And assuming that that's not intentional, what causes that?
They really have no idea what causes it. And that we just treat it with a small dose of medication that we put them on, and it usually will cause them to sleep. It does not stop the leg jerks. We cannot stop that.
So you're not sure what causes it, but the medication at least
allows them to sleep. It's a small dose of a sleeping pill, and we put them on for approximately 2 weeks on, 1 week off. It's a drug-free holiday for the 1 week.
And how many people would have that?
We probably see at least one a week that has that.
What are some of the other things that you had mentioned?
Most of the patients we see have what we call obstructive sleep apnea, and these are the patients who have the symptom of the loud, obnoxious snoring.
Why are you looking at me when you're saying that? You know I have a loud, obnoxious snore. She knows I wouldn't have asked her to be on the show if I didn't snore, right?
That's what he said.
Yeah, my wife is a nurse, and she, of course, said I had to make sure to call the Sleep Referral Center over at Mercy to find out what my problem was. Now, if you snore, does that automatically mean you have a problem?
No. A lot of people snore. A lot of people only snore when they've been drinking or they take medication because it causes them to have a lower threshold on their arousal system, and it also relaxes the muscles in the throat, allowing them to snore. Just because you snore, it does not mean you have any of the other symptoms that will go with sleep apnea. If they would call the center, we triage them over the phone. And if they don't have any symptoms and they really want treated, we usually refer them on to an ear, nose, and throat physician.
Okay, so snoring is just a symptom.
Right, of obstructive sleep apnea.
What are the other symptoms then?
These people are tired during the day. These are the people who usually can carry on a job unless it's a desk job. They usually have trouble with that. They a lot of times have trouble driving home because they're tired during the day. They usually can't watch television because they fall asleep. They have trouble reading a newspaper. If they have a desk job, a lot of times they're found sleeping at their desk.
And what age group does that usually cover?
Generally, you're going to find this in males, anywhere from about the age 30 to 70. You also find it in children.
That's us. Sorry, guys. You also do find it in children.
Right. You'll see this in children. Any child that snores should be treated by a physician because usually it's an enlarged tonsil or something. If they're snoring, they're disrupting their sleep possibly with some apnea, and this is the stage where they grow.
Okay, but we need to define snoring because all of us, I think, at some point when we're rolling over, let out a little snore, right?
Sure. A lot of people only snore on their back. A lot of people only snore on their side. These people with sleep apnea, what apnea is a pause in the breathing. These people actually stop breathing. And what we do is we measure it for 10 seconds or greater. Anything over the 10 seconds, then we count it as an apnea. And anybody that has 5 apneas or less per hour is considered normal. Everybody has apnea. It's just part of your sleep. They'll occasionally stop breathing. It's the patients who have it for 5, 6, up to 600 times an hour that we treat.
Now, my wife says that she can push me and let me roll over to my side, and then I stop snoring.
Right. When you sleep on your back, it just allows the excess tissue and the muscles in your throat to relax more, and as you inhale, you suck together. And as you're inhaling and exhaling and sucking together, you cause a vibration in your throat, causing the snoring.
So I'm asking you if, since I don't snore on my side, does that clear me up from any serious problems?
Has your wife ever said that you stop breathing in your sleep,
I
or
don't
she
know.
hears pauses, or you have loud snorts or gasps?
Yes, I think so.
Do you have trouble staying awake
When?
at night
Yes. Oh, I get really tired about 7 o'clock at night. I'm just exhausted.
after you eat?
Yes, I'm just exhausted after I eat at night.
Does she ever complain you're a restless sleeper? You toss
all
and
the
turn
time.
and kick
Sure,
and throw
that's
your
all I
arms
do.
to resume breathing?
I'm constantly tossing and turning.
Okay, these are the type of people that would need to come to a center. If it's just the ones that complain about the snoring, no. Because snoring can be treated either a lot of times with weight loss. A lot of people put on 10, 15 pounds and their wife starts complaining they're snoring. Weight loss a lot of times will help get the excess tissue out of the throat, or surgery will always work too.
What about change of habits? Are there any habits that cause snoring, like maybe eating at night before you go to bed or something?
Usually not, because it's the excess tissue in the throat, at the back of the throat, behind the tongue. Alcohol after 7 o'clock will cause you to snore. Narcotics, like if you have to take a sleeping pill or you have to take a pain pill, this will cause you to snore also.
So when they call you at the Mercy Referral, Sleep Referral Center, do you ask them a list of questions about
I
their
ask them
lifestyle?
everything I just ask you. And then we just go from there. If they would come up with every answer like you did as yes, we would then set them up to see a physician who has been specially trained in sleep disorder medicine. And we have 13 physicians on staff in different areas.
Now, how in the world do you measure the apnea aspect of it?
Okay, what we would do is after they see a doctor and he thinks it's necessary that they have a sleep study, then we would bring him in another night and they spend the night with us. They get out the next morning in time to go to work so they don't miss work. But what we do is we monitor their eye movements, their brain waves, muscle activity of the legs. We monitor their breathing through the nose and mouth, the effort of their breathing from the chest and abdomen. And then it all comes out in about 1,000 pages of paper. We go back through that and measure everything. We measure what the heart does, what it does with an apnea, without an apnea.
But that's really a very unnatural place to be. If I go in there and have a night's sleep, is this at Mercy where you have a night's sleep?
Right.
That's
It's
not
all
as normal,
taken,
is it?
right, it's all taken into consideration. This isn't a normal night with 25 wires hooked to you.
Well, I don't know.
Some people sleep that way, I guess.
Our guest is Joe Fisk, the coordinator of the Sleep Referral Center at Mercy Hospital. You can join the conversation, and I know there are a lot of people who have questions about their spouses, their children, family members, sleep problems. Joe, you're a registered polysonographer.
Right.
And what does that mean?
It means I'm a technologist who's taken a 3-day board exam to become registered in sleep disorder medicine.
So you're not a nurse,
Right.
but you're a technician.
Technologist.
Or a technologist. All right. Well, I'll get it here. And so your specialty area is sleep disorder.
Right.
And where did you have to take this program?
I studied out in Anaheim, California for a winter.
And is this something new that hospitals are doing, these sleep referral centers?
Sleep has been in the medical field approximately 25 years is all, and it's been taught in medical schools for approximately 3 years now.
We have some callers on the line. You can join us at 284-1040. First, let's go to Sue. And Sue, tell us about your problem.
I just wondered do they ever treat people with sleep paralysis?
Sure we do, but sleep paralysis generally is a symptom that correlates with narcolepsy. Do you have any of the other symptoms that would go with it?
Well, this happens about 8 to 10 times a month, and it started when I was about 17 years old, and I'm 30 years old now.
Sue, I don't understand. What are you telling us your problem is?
Okay, either I'll be just going to sleep or just waking up in the morning, and I feel like I'm awake, but I can't move any part of my body whatsoever. It's just like you're totally paralyzed.
Is it usually, though, when you're getting up in the morning?
No, it's more in the night, right at like within 2 or 3 hours after I've gone to bed. It's when it most of the time happens. I can't sleep on my back anymore because of this, because I've choked trying to wake up and get out of it. And it's a very frightening thing when it happens.
Right. Do you ever have any trouble with inappropriately falling asleep?
No, I don't have that part of it, no.
You don't have any of the other symptoms other than the sleep paralysis?
Just the sleep paralysis.
I don't really know. I could talk to a physician and have you give me a call, and I would ask her if she would treat anything like this. Usually
yeah, I didn't know if they were able to treat this type of thing or not.
Sue, have you ever asked a doctor about it?
No, I'm a nurse, and I'm around doctors all the time, and I never have mentioned it to them.
Yeah, I would almost ask a neurologist. That's who you'd need to talk to.
Okay, well, I just wondered. Thank you very much.
Thank you for calling, Sue. And, Joe, sometimes nurses make the worst patients, don't they? That's what I hear.
I think doctors are worse.
Winnie, you're on the line with us on WHO. What's your problem?
Yeah, I feel like I need a sleeping pill after I've gone to bed 2 hours. I wake up in the middle. I go right to sleep with no problem. I'll wake up in about 2 hours, and I'm wide awake, and I'm awake 4 or 5 hours before I can ever get back to sleep, and by then it's time to get up. Now, what causes this?
Do you nap during the day?
Beg pardon?
Do you nap during the day?
I work.
Okay, do you nap in the evenings?
I do not nap ever.
Okay. Do you have a bed partner that would have any knowledge?
Don't have a bed partner at all.
Okay, so you really wouldn't know what was causing you to wake up. Do you get out of bed, or do you just lay there?
Well, I usually get up, go to the bathroom, and go back to bed, and then I'm even more wide awake.
Okay, the best thing to do is if you can't go to sleep after 20 minutes, always get out of the bed. So you don't make the bed a negative place to be. Get up, go to the front room, sit in a chair, do not lay on the couch. Don't make it so that you could easily start falling asleep on the couch again. Read a magazine, read a book, watch television, anything relaxing. Some people also find that if they get up and they do something they dislike, it's much easier to go to sleep. A lot of times I'll get up and dust. I hate to dust. I can go right back to sleep real fast.
Winnie, how long has this been going on?
Oh, I'm guessing for about 2 years.
Was there any change in your lifestyle 2 years ago that would have brought this on?
Well, I lost my husband 3.5 years ago.
Joe, does that have anything to do with it?
It would, but you wouldn't think it would start 1.5 years after it. Usually, early morning awakenings also are a little sign of depression, so it might be associated with that.
Well, this can go on for maybe 3 or 4 nights in a row, and then all of a sudden I'll have a real good night's sleep, and it has no pattern at all.
Okay. We could also send you some relaxation techniques. Have you ever tried anything like that?
No.
Those also work real well, or the tapes that you can use that help you relax and help you go back to sleep.
Like cassette tapes you're talking about?
Right. You can just buy them just about in any store.
Like listening to the surf again?
The surf, or they have ones that talk to you on how to relax, this type of things.
Okay.
Those work real well also.
Well, it seems like with the radio, not music, but talk shows I listen to that they do all night long. I really do, too.
Are you telling us it's too bad Jan isn't on at night? Is that...
I don't know whether it's boring or what, but
we're going to get in trouble here.
And it seems to have helped me.
Well, as long as you listen to WHO, I guess that's okay. So. Okay, well, give them a call there at the Sleep Referral Center, okay, Winnie?
Okay, thank you.
Thank you for calling. And Dave, you're on the line. Tell us what's your concern.
Okay, I've had a boy who was an asthmatic, and he started coughing at night, 2 or 3 years ago, considerably. And, of course, we had to get out and help him, and then he started taking shots, and he's got over that. I wake up at the drop of a pin at night. I just can't maintain sleep.
Do you have any other symptoms that would go with why you're waking up?
Well...
Is it noisy where you live? Do you live by the airport? Do you live by a road that's real noisy? Do you have a dog or a cat you'd have to take care of?
Even if the furnace kicks on and it'll wake me up.
Okay. A lot of times we will have patients try earplugs or very light sleepers who any noise causes them to wake up.
Yeah, that might be a good idea. I never thought of that.
Yeah, that sometimes works. They can also get ones that just mute out some of the noise so you can also hear your alarm clock, this type of thing, or if something would happen in the house, you'll hear something loud. But it gets rid of the small sounds in the background that would disturb your sleep.
Dave, does this happen every night?
Just about. There are, well, let's put it this way, there are very few nights that I don't wake up at least once.
Mm-hmm.
And how do you feel during the next day, then? Are you really tired the next day?
Yeah.
Are you able to go right back to sleep?
No. Usually I lay there for, at least 45 minutes.
Okay. I would almost try the earplugs first, because it's just something you can get over the counter and it's not very expensive.
Yeah, it sounds like a good thing to try.
Okay, great. Well, thanks for calling, Dave. What about, Joe, what about the type of bed that you have?
That's up to the person, whatever you're comfortable with.
So you're saying the bed really makes no difference in terms of sleep?
And if you sleep with 2 pillows versus 7 pillows, it doesn't matter. It doesn't matter how long you sleep. It's what you're comfortable and what you feel well with the next day.
Talking about sleep disorders, it's an interesting subject, and Joe Fisk was telling us that the bed doesn't make a lot of difference, and you're also saying pillows don't make a lot of difference either, right?
No, as long as you're comfortable. When you go to a hotel, things are going to be different, so you're not going to have as good a night, but that's normal. What you have at home, what you're comfortable with, that's what you sleep with. If you sleep with 4 blankets, that's fine, versus somebody who sleeps with a sheet.
What about the people who prop themselves up? I notice some people use 2 or 3 pillows to really prop their heads up, and other people don't use any pillows at all.
A lot of people think if they prop themselves up, they won't snore, which isn't true because you're going to snore anyway. A lot of people have emphysema or COPD, something like this, a breathing disorder, and have to be propped up. And it's whatever's comfortable. Once they're up and they can breathe normal, then they'll sleep.
We did have a person who was on the line. She's not on anymore, but she was asking about trouble going to sleep at night. She said that she just has some problems getting to sleep at night. What are some of the things that you tell people to look at in terms of lifestyle that might cause them problems going to sleep?
Usually on somebody who has difficulty falling asleep, we try to teach them proper sleep hygiene. You go to bed at the same time each night, you get up at the same time each day, even on the weekends. You don't just sleep in on the weekends and expect to get your sleep back to normal by Monday again. To stop drinking after approximately 7 o'clock in the evening. Drinking is very disruptive to your sleep. Other than it also causes you to snore, it fragments your sleep. Now, I'm not saying like 1 glass of wine or something. I'm talking about somebody who goes out and has 3 or 4 drinks. This will cause fragmentation of the sleep.
So you're saying the people who go out and have a drink with friends at night, like 9, 10 at night, they're possibly causing themselves some problems.
Right, because they're going to fall right to sleep, and also people think that having a drink or 2 allows them to sleep better, but it doesn't. You will fall right to sleep, but then you also notice you have frequent arousals throughout the night, and it's because the alcohol's wearing off.
Joe, I wanted to ask you about eating, because I think all of us love to eat at night. Just about everybody I know loves to have a little snack.
Right, and a little snack's fine before you go to bed. In fact, usually it's recommended to patients who have insomnia. A lot of times we'll recommend they have something that contains L-tryptophan, which is a natural amino acid that helps induce sleep.
What kind of foods would have that?
Milk has it. It's not an old wives' tale to have a glass of warm milk before you go to bed because it does contain the L-tryptophan. Turkey has it, chicken has it, cheese has it, cashews, a lot of the nuts have it, crackers.
See, that's why I've noticed that every holiday, whenever we have turkey, I get just exhausted. I'm serious.
It does.
After I have the big turkey dinner, I'm exhausted. We figured out finally that it's the turkey. So there is a reason for that.
It's the L-tryptophan in the turkey.
Now, does that guarantee that you're going to have a good night's sleep then?
No. This won't guarantee anything, but it does help induce sleep in some patients.
So you say nibble on a couple of pieces of turkey before you go to bed.
And some people this works great for. Other people it won't phase.
Certain people obviously can eat certain foods and have no trouble before they go to sleep.
Right. A lot of people also have what we call esophageal reflux. Now, when they eat before they go to sleep, or they eat a large meal late in the evening, when they go to sleep, they lay down. Instead of the esophagus being able to push the food on down, it regurgitates it back up, causing indigestion. And this usually can be stopped if they do not eat before they go to bed, or they move their large meal to earlier in the evening, like at 5 or 6. A lot of times nothing will work for them, so medication has to be introduced.
Well, what about people now during the day who, for instance, after lunch, get really tired?
Okay, this is normal. This is a drop in your circadian rhythm. Usually between 2 and 4 are the worst times for people. This is when the circadian rhythm drops and they become tired. A lot of times that's when offices give people breaks so they can get up and move around. They can go get a cup of coffee, a glass of pop, whatever, just to get them moving again. It's also the time that most people are driving home.
Yeah.
So you have to watch out for that also.
Now, another old wives' tale, old husband's tale maybe in my case, taking a little nap. I know somebody who goes into his office and takes a little nap in the middle of the afternoon. Is that a good idea?
Usually we don't suggest naps to anyone. They're just not good for your sleep during the nighttime because you're disrupting it by taking part of it out. A lot of people who nap in the mornings will take out a lot of their deep sleep from that night, or people who nap in the afternoon will get a lot of their dreaming stage of sleep out of the way, so that their sleep at night is going to be disrupted because they haven't had the proper amounts of sleep.
They get their dreaming stage out of the way.
Right. Usually in the afternoon, if you sleep, you'll dream a lot. And you'll have more of the dream sleep, so then late at night, then you won't have as much dream sleep as you normally would.
And you're saying the dream sleep is the good sleep?
It's essential to a normal sleep, and napping just disrupts your sleep.
What about for kids? Now, obviously, younger kids need naps.
Okay. Children's sleep is completely different.
Okay.
Children, when they sleep, also excrete a hormone that causes them to grow. So if they don't get the proper amount of sleep, or they have a sleep disorder that disrupts their sleep, they aren't going to grow properly. So yes, they do have to have their sleep, and right off the top of my head, I don't know how many hours.
Okay. Now, we've been talking about people who have trouble getting to sleep. What about the opposite problem, which is people who sleep too long? I know a couple of people who just can sleep forever.
Okay.
Is that considered a sleep disorder?
Not necessarily. They could be what we just call long sleepers. They have to have...
Oh, is that the technical term for it?
10 to 12 hours of sleep. There's people who are called short sleepers. They need 2 to 4 hours a night. These people also could have something that disrupts their sleep, which causes them to have abnormal sleep patterns, so they want to sleep longer and stay in bed longer. They could have the sleep apnea. They could have narcolepsy. They could have the myoclonus.
So there is no standard, you're saying?
Right. Whatever makes you feel better, as long as you don't have a sleep disorder. 7 hours sleep is usually normal for everybody.
Well, then why do some have trouble waking up in the morning?
They could have a sleep disorder. You mean have trouble waking up and working out fine during the day, or being tired during the day?
Just trouble waking up in general?
Just trouble getting up?
Yeah.
I think that's just normal for anybody. I don't know too many people who like to get out of bed.
Oh, no, I love to get up in the morning. I'm up at 5 in the morning usually. I'm at my peak performance first thing in the morning. And yet I had a roommate in college who was just the opposite. He was a night owl. He stayed up till 2 in the morning. He was a doctor. He's a medical student, of course. Just thrived on energy, lots of coffee till 2 in the morning. Then he crashed, and you couldn't wake the guy up in the morning. As much as you tried, even if he got 8 hours of sleep, you could not wake him up.
Because that's his sleep pattern. You're a morning person. You like to get up at 5 or 6 in the morning, but you're ready to go to bed at 9 or 10 o'clock at night.
Right.
Now, I like to get up at 10
I'm ready to go to bed at 7 o'clock at night.
I like to go to bed at midnight, 1, 2 o'clock, but then I want to sleep till 10 or 11 in the morning.
Right.
I don't like to get up in the mornings. In fact, I just soon sleep during the day as sleep at night.
So you're saying it's just whatever an individual person does?
Whatever you're comfortable with.
See, and this is where I get concerned, because I have 3 kids, and they obviously have slightly different sleep patterns, but I think as parents we tend to want them to all have the same sleep patterns.
Right.
We all want them to go to bed at 7:30 or 8 o'clock and then wake up at 7 in the morning, and yet if I hear what you're saying, that's not necessarily going to happen.
Right. You're also going to have children who have insomnia. And these children who don't go to sleep till 10 or 11 or 12 o'clock at night, but then you expect them to get up at 7 o'clock because that's what time you have to get up.
Joe Fisk is our guest, and Harold, you're on the line with us. Do you have a question for Joe?
Yes, good morning. My sister's 58. She retired from John Deere, and she worked from 8 to 4:30. And since she's been retired, she can't sleep at night. She stays up and plays solitary and till 4 and 5 o'clock every day. And I've been trying to get her to go to a doctor, but she drinks beer a lot, and I was just wondering if that beer could have anything to do with her.
With her insomnia?
Yes.
It can. It's going to disrupt her sleep, so if she did go to sleep, it's going to fragment it, so she's going to constantly wake up, and so she's going to want to get up and, like, have another beer, sit around the table, have a cigarette, whatever. You see that a lot. You also see patients who have trouble staying asleep like this. She could be a little depressed from no longer working. She needs something more to do. She probably sleeps now during the day.
Yes.
Right, okay, she's got to change her sleep habit back unless she's happy with this. Some people are very happy with staying up at night and sleeping during the day.
Is she happy with it, Harold?
No, she isn't. I try to get her do a part-time job, but maybe that would...
Right, and get her back on a normal sleep schedule, the proper sleep hygiene of going to bed at night and getting up in the morning. That's the first thing she has to learn, is even if she stays up all night and only sleeps an hour or two, she's got to get up at a normal time in the morning and not just continue sleeping through it.
All right, then. Thank you.
Thank you for calling, Harold. Don, you were going to talk about sleep paralysis. Is this a case that you've had, Don?
Yeah, that's right. I've had a few episodes of it myself. Did she say she worked with doctors a lot?
Yes.
Is that what you said?
Yes.
Yeah. It's not uncommon for people in medical field that switch shifts a lot to have sleep paralysis.
Why?
It's just a change in your sleeping habits. You know, I switched to working nights. I also work in a sleep lab, and when I switched to working nights from days, I had like 4 episodes. But how often did she say she was having them?
8 to 10 a month.
How much?
8 to 10 a month.
Yeah, if she's having it that often, she really needs to get into a sleep lab and have herself tested.
Yeah, that's what she was going to do. She works in a hospital, she said, so she would contact a neurologist.
I see, yeah.
And Don, do you find that true, too, that people who are involved in the medical profession tend to hesitate to go see doctors or get help?
I would guess they do, yeah. Yeah, a lot of them are just even though they know the symptoms, they kind of put it in the back of their mind and don't really want to think about it, I think.
Yeah. Well, thank you for your comments.
Uh-huh.
Joe Fisk is here from the Sleep Referral Center at Mercy Hospital. Joe, what about medication? A lot of people depend upon, for instance, over-the-counter drugs to help them go to sleep at night. Is that good or bad?
We don't recommend any medication for insomnia. Usually we'll work with the behavioral aspect of it. We do not give out any medications at the sleep center for insomnia.
And why is that? Do you think it makes the problem worse?
Right. Sleeping pills do not help the problem unless it's just a transient problem. If it's something that's going to last like a week or so, jet lag, this type of thing, anything that's just real minor, then can be treated with a sleeping pill. Any long-term treatment with a sleeping pill is not good for your sleep.
You're saying if somebody right now is buying over-the-counter stuff, just stop and just ride it out, you're saying?
Right. It's not going to do your sleep any good because you're going to have to start taking more and more and more of it as you become more habitual with taking it.
Don, are you being treated right now for sleep disorders?
Yes.
And tell us about your case.
Well, I had trouble sleeping at night, and I just kept getting tired and fall asleep every time I'd mess around or work or talk or walk or whatever. I'd want to fall asleep. And I went down and got tested at Mercy, and they said I need to be fitted with a nasal CPAP, and which I've been wearing now for exactly a year to the day.
What is that, a nasal CPAP?
And that nasal CPAP is what it does is it forces air through my nostrils, and it keeps my throat open at night so I can breathe. I would quit breathing at night.
So this is something you wear over your nose at night when you sleep?
Yes, it is. It's something I wear over my nose.
Was it tough to sleep like that at first?
It was tough to begin with, but And now it's kind of like a security blanket. I don't want to be without it.
That's interesting. You were going to ask something about a dry nose, too.
I was going to ask her, Joe, if there was anything that they could do about a dry nose.
Okay, have you tried anything at all, Don?
Have you tried any nasal sprays?
Yeah, every day. Every time I walk by it, I keep one in my pocket.
Okay, is it the one we gave you?
It's AYR.
Right, okay. How about you give me a call when I get back to the office, and I'll get one of the doctors, and we'll get you a script sent in since you're having so much trouble.
Okay.
And we'll just get your sinuses cleared up. What it's done is it's dried out your sinuses.
Yeah, I end up taking cough medicine or something like that at night to go to sleep because they're always plugged up, and in the morning it's just nothing but blood. So. Yeah,
we need to treat your sinuses, so give me a call at work, and I'll get that taken care of for you.
Okay, no problem. Thank you.
Thank you, Don.
Bye-bye.
And is that common with people who are on that CPAP machine?
Right. What it's done is it's just dried out his sinuses from the air blowing into him, and then we'll just give him a prescription nasal spray, nothing over the counter.
Yeah. Eva, real quickly, we just got a couple of minutes left. You were going to make some comments. Go ahead. Eva, go ahead.
What can a person do when they go to bed at 4 o'clock in the morning and get up at 8, and then they lay down in the afternoon and then go to sleep for a couple hours?
Okay.
Okay, is this disruptive to your lifestyle?
Well, now my husband, he goes to bed at 4 o'clock in the morning and gets up at 8.
Mm-hmm.
Okay, then he lays down in the afternoon and sleeps a couple hours.
Right.
And is there any way a person can sleep longer than about 4 or 5 hours?
If he tried to cut out his naps, he's going to be able...
He works nights.
Oh, okay.
And he goes to bed at 4 o'clock in the morning and gets up at 8 o'clock. Then he lays back down again about, say, 3 or 4 o'clock and sleeps till 5.
Okay. We found this a lot of times in people who work nights. This is the way they like to sleep.
Oh.
Maybe this is normal for him.
Mm-hmm.
Maybe if he went a couple nights without taking his afternoon nap, he'd be able to sleep longer into the day, so he wouldn't have to take a nap.
Well, see, he works every night except 2 nights.
Mm-hmm.
And so that's why I wanted to find out.
Okay, great. Thanks for calling, Eva. What about, you had mentioned before about weekends. Some people, they think if they get like 5 or 6 hours of sleep every night during the week, on the weekend they can catch up.
Right, and there's one thing that's a guarantee is you never catch up on your sleep. Once you've lost it, it's gone. Now, you can go in and you can sleep. If you've been up for like 24 straight hours, you'll go in and sleep for 10 or 12 hours. But when you get up, you're still tired because you're still lacking the sleep. You're never going to catch up on sleep.
So are you saying that we shouldn't try to catch up on weekends, or that we should keep the same pattern 7 days a week? What's the best thing?
Right. Proper sleep hygiene, you keep the same pattern. You get up at 7 o'clock in the morning or 6 o'clock, whatever your schedule is. You go to bed at 10 o'clock.
What about on all vacations? For instance, we've got Van and Connie out there in California with the Rose Bowl game this weekend. Their sleep is all a mess, from traveling, from jet lag, they had to get up New Year's Eve and they got up about 3 in the morning out there or something to do a show. Now, how can they adjust when they come back?
Okay, they're going to be coming back to the east, so they really shouldn't have any jet lag. They're just going to be more tired from all the partying.
So you're saying if you're going to party, have a party every night, right? Be consistent.
Well, sure. If you can get away with it.
Okay, real quickly, with just a minute left, Joe, just some suggestions for each of us for a good night's sleep again, just to review what you said. What about, like, exercise? It's not good to exercise right before you go to bed?
Right. Or a lot of times they tell you not to take a hot bath before you go to bed because it'll stimulate the adrenaline, and it'll cause you not to be able to sleep as well. A hot bath early in the evening, exercise usually in the mornings or in the early afternoon. Otherwise, you'll be too stimulated to be able to fall asleep. And always the most important thing is to keep with the proper sleep hygiene. Keep the normal bedtime and the normal getting up time.
I think I got that message. And I think Joe got a new candidate here to come into the Sleep Referral Center at Mercy. Thank you so much for all your help today. Joe Fisk from the Sleep Referral Center at Mercy Hospital.